It's a newer phenomenon that therapy has taken a central role in the world of recovery. But part of me, I have to say, I'm rubbed a little wrong, in the wrong way by that. Not that I'm anti-therapy. Both my parents are psychologists. I actually love psychology. I'm fascinated by it. But traditionally, we have an understanding that individual psychotherapy is not a very effective way to treat addiction. And so what you'll find most commonly is somebody's afraid to enter into the world of recovery for a variety of reasons. And so they go see a therapist, maybe an addiction specialist, or maybe just a therapist. And I think the most common story is somebody will see a therapist for months or even years while still continuing to engage in their addiction, maybe with some improvement, maybe with no improvement. And eventually that therapist will say, maybe in months, maybe in years, hey, I can't continue in this therapeutic process until you do something about your addiction problem, and I can't help you with your addiction problem. So you need to either go to treatment or Alcoholics Anonymous. It's kind of a shame to me that somebody might be in therapy for 5, 6, 7, 8 years. I would hope that therapists out there recommend that early. And I also understand that if the client's not willing to go into treatment or to seek out some recovery, that the therapist is stuck. So understanding the role of therapy in recovery is a fascinating conversation. In general, my belief, and this is complex and nuanced, is that people have to immerse themselves in a culture of recovery and integrate recovery as part of their identity as the primary task of recovery. And that's like upfront. Upfront, I have to challenge myself to admit deeply that I have an addiction problem that I have not been able to solve. Then I have to take on the task of saying, okay, I'm a person who suffers from addiction. In order to treat this condition, I need to be a person in recovery. I need to be a person who identifies myself as someone in recovery from this condition, just like I would if I had diabetes. You know, if I had a horrible case of diabetes, then my recovery from that, or even a cancer, I would identify as like, I'm a cancer survivor. It almost killed me. And I have to know that deeply about myself. And if I'm a smoker, I should probably quit smoking, right? So that to me is the first and primary core task of recovery. And then therapy comes along in order to better understand myself and treat the underlying emotional conditions that existed maybe prior to my addiction. You know, different traumas and different ways of being, different blocks that I had, et cetera, that caused me to suffer, that I then use drugs and alcohol to treat. So I think of therapy as, by and large, the later stages of recovery. You know, first I have to be a person in recovery. Then I can work on this other stuff. Because if I'm not a person in recovery, I'm going to continue to use. I'm not going to get any therapeutic work done, right? There are exceptions to that. The exceptions to that are if I have a trauma that's so severe, it's getting in the way of me being able to identify as somebody in recovery, right? So if the psychological problem or even psychiatric problem is so severe that I can't engage, an easy example is if I have a really hard time regulating my emotions, I'm incredibly impulsive, it will be impossible for me to engage in recovery because I can't sit still. I can't stop talking. I can't take information and reality in. So a specialist, a therapeutic specialist, would have to come in and treat my emotion regulation impulse disorder in order for me to engage in recovery. But in general, I think that's the exception.